Now, is the GP pay route punishing patients? That's what the Health Secretary reckons. I'd love to hear your thoughts on this one, so do give us a call right now. So Wes Streeting has accused family doctors in England of punishing patients after they voted to take industrial action, which is the first time in 60 years, in a row over funding. Now, this was the headline on the Daily Mail today. It reads, "Say goodbye to your doctor's appointment. Patients to be punished as GPs start months of work to rule." Now, GPs have decided they will limit how many patients they see a day to just 25. Now, that is about half of what some have previously covered. Let's just have a little listen to what the Health Secretary had to say about it.
What I would say to GPs is that the Tories got a kick in at the general election, and you won't be punishing them if you take collective action. It will be patients who are punished. And we're now 4 weeks into a new Labour government. We were voted on a mandate of change, and I think we've shown in the first 4 weeks our determination to work with general practice to rebuild it with GPs in partnership. So I don't think collective action is necessary because you've got a government that now wants to work with you for the interests of patients. So that would be my message to GPs today. Let's work together to rebuild general practice.
OK, so Krista, do you think people will have sympathy for the doctors over this?
No, I don't think that they will. Well, actually, I'm a bit more nuanced than that. I think that they will have sympathy for the fact that GP general practice needs better funding. General practice accounts for a much higher percentage of care than the funding it's been awarded. And
Which is what the row's over.
Which is what the row is over. But it was the last government that decided on this 1.9% rise in funding, which is not high enough. And so it seems so bizarre that when clearly the Labour government, love them or loathe them, agree or disagree with them, giving the junior doctors 22%, which is going to cost absolutely billions. Pensioners are going to pay for that. Good luck. I think that clearly it seems ridiculous that you wouldn't put those concerns to the new government and say, right, if we don't have this addressed, we will consider this work to rule, rather than the BMA saying, well, actually, we're not even going to wait to see what they're going to come up with 4 weeks in to a funding package agreed by the government that's just been kicked out.
And Wes
we're going to go to this
saying,
work to rule.
Yeah,
it's
he
ridiculous.
is saying that he may increase that. Nelufar, where do you stand on this?
I think it's a really tricky one, because at the heart of what the GPs want is patient safety. That they're not just dealing with being able to kind of be paid more or less, or be given being paid in a way that means that their workload is in a reasonable manner. For me, what stands out here is the fact that the GPs are calling it on the fact that for 15 years they've been dealing with essentially children, people who weren't taking this seriously. They have been absolutely whittled to the ends of what a GP should handle. They are harassed, they are underfunded, they are absolutely stretched within a limit. So yes, Mr. Steering is inheriting a terrible legacy, but the GPs need to organise and need to call for better funding and need to call for better hours of work. This isn't just about pay. I really think it's important we go back to the fact that this is about patient safety. And that's what the British Medical Association and what the GPs are saying, that the way that they are dealing with us, the fact that you can only bring one query per 10-minute appointment, the fact that they are stretched to within limits is the point. And 15 years of waste and neglect is what they are responding to. And I think it's fair enough that they are raising their hand.
From a government that's no longer in power. And since the Labour have come to power, Wes Streeting has actually, I think, assigned about £80 million so that a lot of the locum doctors that there wasn't the budget to get on board can now be hired. 1,000 of them can now be hired. So again, if they're responding to this 15 years of a party that they've not agreed with, I get it. And have the Conservatives won the election and said, right, we're sticking to all of our funding principles and not hiring those doctors, I could understand the logic, but I
think the idea is that this action would take a while to actually filter down to the patients. But let me just bring in the patient watchdog, Healthwatch England, which has said they're really worried about the decision the GPs have made due to the difficulties patients already face with trying to get an appointment. So let's speak to the watchdog's deputy chief now, Chris McCann. Chris, thank you for joining us this morning. How concerned are you by the decision to limit how many patients are seen per day?
Well, I suppose the thing to put in context is we hear more about GP access than we hear about any other issue. It's the thing the public comes most to us about. And that's understandable. It's the front door to the NHS. And we recognise the challenges that GPs and their teams are facing. But we do have concerns about the collective action proposals that have been set out by the BMA. These could exacerbate the access problems that people have, and even potentially deter people from seeking help altogether if they are unsure whether their GP is still open to patients. And what we really need to have happen while this action is ongoing, we need to make sure that patients are given clear communication about access to their GP. They need to make sure that they're telling their patients what action they're taking, and if they are taking action, making sure that they're signposting them to other services that can help them, whether that's a pharmacist, NHS 111, or whether they need to go to A&E. But as I said, there are already real issues about access to GPs. We've all experienced that issue of trying to get the call through at 8 a.m. and maybe you're trying to get the kids out to work, or you're trying to get to work yourself, or you've got caring responsibilities. And certainly, if the action is extensive, and we don't know how extensive it's going to be, it will have an impact on the public.
And this action has already started. You sort of were giving some advice there, but if you are at home and you do want to go to the GP in the next week or so, do you think that you will start to feel the difficulty of getting those appointments right away?
Well, the thing we don't really know yet is the extent of the action. Obviously, not all GPs are part of the BMA. Not all GPs will take the same action, because the BMA has set out 10 different types of action that the GPs can take. The one that is most likely to have the impact on patients is if GPs start to cap the number of appointments that they see during the day at 25. And if that does happen, well, then you will see an impact. But right now, we really don't know how many GPs are going to take that action, which I suppose only adds to the confusion and will potentially add to the concern for the public, because GPs can't strike in the way that junior doctors or nurses have done over the past 18 months to 2 years. They're taking this collective action. They will still be fulfilling their contracts. So what we need to see how widespread the impact is. But obviously, from the perspective of Healthwatch, we want to urge both parties, the BMA and the NHS, to get together and resolve this issue as quickly as possible.
Absolutely. Chris, thank you so much for joining us this morning. Lots of you are calling in, so let's go to some of those calls now. Tam from Manchester, what are your thoughts on this?
Hi, good morning to you, panel. I think it's a bit of a joke with the doctors, and they have been punishing us since COVID. In my own doctor's surgery, I can go in there at 9 o'clock, 11 o'clock, 1 o'clock, 3 o'clock, 4:30, and the place is empty.
What, your doctor's surgery right now?
Yes.
Well, we need to head to Manchester, don't we? Why do you think...
They're not seeing anybody. Why is the waiting room empty? And if you're lucky enough to phone up and get through and be number 42 in the queue, you're lucky to get an appointment.
Okay, so maybe less of the video calls. Well, they should have more time for that now. They should have more time for those, face-to-face interactions, because they won't be seeing as many people per day. Thank you very much, Tam. Peter in Torfaen, what are your thoughts on this? Are you in favour of the GP's action?
Yes, I am in favour. The reason being, I see my doctor once a month, and I speak to her quite a lot about what's going on. She's concerned that there is no money. If they need a doctor, they won't get one because they use a practitioner because it's cheaper. The Labour government, before they got in just now, because we are Labour down here anyway, they promised that they'll be building more surgeries. Well, in actual fact, where I live, they've closed 4. So all the patients from those surgeries now go to my surgery, which is the only one in the area. And if you try and get an appointment, the last appointment I got to have my bloods taken was 7 weeks. Wow. 7 weeks, unbelievable.
You say you're in favour of this, but surely if they're going to be seeing less patients per day, it means that 7 weeks could go to 10 weeks, 14 weeks.
Well, if they don't dispute, the problem is that they'll never get anywhere because the government is just going to walk all over them, and the doctors have got to do what they think is right.
You make a good point, because actually the last time they did this, which was 60 years ago, they had quite a good response from it, and they got sort of more rights. Peter, thank you so much. Anne from Hertfordshire, what are your thoughts on this? Do you think the GPs have... Good morning.
It just really annoys me because I I was referred 18 months ago for cataract surgery. I've had my left eye done, and I was told I've got to wait anything up to 3 years now to have my right eye done.
Wow, that's...
And it's just outrageous. You cannot see a doctor.
And is that would a
doctor
GP
the
be
other
doing
day.
that?
The GP needs to refer me again.
Okay, and
I
you
can't
think
get
the
an
hold up
appointment
comes...
to make the referral. And then they had the cheek to phone, the hospital had the cheek to phone me and asked me if I got a £500, I could have it done tomorrow if I went privately.
Well, this is often what you hear people saying. You know, they have to go and pay for healthcare now because otherwise they have a 3-year wait on their hands. Yeah, okay, well, so you ultimately think that they shouldn't be doing anything apart from
I'd take their
seeing
wages
you,
away.
helping.
I'd sack them all.
You'd sack them all?
Disgraceful. Yeah,
I'm not sure if that would help anything. We need to recruit more GPs, not sack anymore.
I think the doctors are just it's just money grabbing now, and they've got to stop it.
Okay, Nelufar, what are your thoughts on this?
I hear what you're saying, and I can't tell you how disappointing it is, Anne, to hear that the hospital are telling you to go private. How dare they, frankly? You're obviously in pain, you're obviously suffering, and if the GP is part of the problem, then things need to change immediately, and I'm sorry you're going through that, honestly. I would say one thing, though, and this is just food for thought for you. I wonder, along with wanting more money, because a lot of these... What's happening across the country is that the GPs are essentially becoming bankrupt. The practices are closing because they just simply aren't bringing enough money versus the amount of care and attention and responsibility they have. And I wonder if we need to, if the government, if the health minister needs to work harder for you in order to make sure that the best GPs stay in the practice for longer. Because the way it is at the moment, it's not just about how many patients these see. It's not just about a quantity thing. It's about the quality of care, and you're not receiving it, and that's wrong.
Well, Anne, thank you so much for your call. I really hope that you get your operation done sooner than 3 years.